Well, as coronavirus cases reach new daily records in the U.S., some states are taking action to try to stop the spread. New restrictions are coming to New York, with Governor Cuomo announcing that any establishment with a state liquor license, including bars and restaurants, must close at 10 p.m. Gyms will also close at the time. Meanwhile, San Francisco rolling back reopenings as COVID cases surge in the city along with the rest of California. Ohio now adding a statewide mask mandate. I want to bring in Dr. Jen Caudle, family physician and associate professor at Rowan University. Dr. Caudle, great to have you on. Are you surprised at all that the country is back to this really dangerous point?
I'm not entirely surprised, but I'm disappointed. You know, we knew even in the summertime that things probably would get worse in the winter, and that's what we're seeing. What's disappointing is that we've been coming into this fall and winter as we are now. Cases are soaring, which was predicted, but we're not doing everything we need to be doing. We really don't have a national strategy to be combating COVID-19 and coronavirus. People are getting tired. They're getting angry. They're getting frustrated. Many are not wearing masks. And then, of course, we've got the holidays, Halloween, Thanksgiving coming up, et cetera. People are spending more time indoors, and especially with these holiday gatherings, I'm concerned. So I'm disappointed, but I'm not entirely surprised.
So cities like New York and the state of New York was doing so well at flattening the curve. The percentage of positive cases was less than 1% at a point. What changed? Because all of the rules are sort of still in place. Why are cases escalating so much here?
Well, that's a really great question. So what we're seeing is that cases are escalating everywhere pretty much in the country. You mentioned some of the mandates that are being put into place in other states, Ohio, et cetera. Literally, since November started, we've already had 1 million cases of COVID-19, and that's just since the beginning of November. Many days we've seen well over 100,000 cases, which, by the way, we really hadn't seen before the last couple of weeks. Texas reported over 1 million cases in that state alone. So we're seeing a nationwide shift to pretty much almost everyone having more cases. Not only that, but more hospitalizations. And of course, we are worried about more deaths. Why it's happening? You know, again, coming into the wintertime, colder weather does sort of sometimes create an environment that may allow viruses to sort of be present easier. But we know that people are going indoors and spending time with one another. And of course, you know, with restrictions in schools and things like that, there are probably many reasons why we're seeing cases going up. But it's happening everywhere in the country.
Are cities, though, better equipped to deal with an influx of cases this time around? Or do you think we're going to end up in that same type of situation where hospitals are going to be overrun, there's going to be no PPE? What is your take, at least, on the health system?
Yeah, well, so unfortunately, we are starting to see hospital systems already starting to be overrun. There are many hospitals throughout the country that are already starting to reach capacity. We certainly hope that doesn't happen. We hope that does not happen in New York like it happened before, and we hope it doesn't happen any further in different places. But we're starting to see that. ICU beds, hospital beds, ventilators, and things like that already being used up, resources, et cetera. So that is something we are seeing nationwide. One thing we are doing better at is we are better at treating COVID-19, meaning we've had a good sort of 10 or 11 months or so of practice. Doctors, we have better treatments. We know more about the disease. We have better ways of managing patients with the condition. And so that is a good thing, that with all this time, we've learned how to treat people better. The hope is that we don't go back to what we were before, but the truth of the matter is in some ways, cases are higher. Daily count cases are higher, and positivity rates are going up. We hope we don't go back there, but it's probably going to get worse before it gets better, and that's what the concern is.
Pandemic fatigue is definitely real. Do you think that that's playing a role here? And do you expect that Americans will follow these restrictions, given that so many seem to be unenforceable?
You know, I do think pandemic fatigue is real. I mean, it's been 10 or 11 months or so that we haven't been able to literally sort of reach out and touch one another. We haven't been able to hug one another. You know, I haven't seen my family in 10 months. You know, these things are hard. It's tough. And I know that people are exhausted and tired. We all are. But we can't really give up. We have no choice but to keep at it. We have to keep wearing masks and social distancing and doing all of these things. It's really our best bet to getting out of this. So I'm really hoping that even though I know we're tired and we're frustrated and we all want this to be over, we have to stay the course.
Thanksgiving is coming up, of course. it's a time when people want to get together with their family. In New York, there's a limit, a 10-person limit on indoor gatherings, which most Thanksgivings have 10 people or more. Any advice for people right now as we're 2 weeks ahead of this holiday and they're trying to make some plans?
Yeah. So there are ways to make Thanksgiving safer. I'm going to give you a couple of those. Of course, follow your state and local guidelines for gathering size limits you need to do. Obviously, the smaller the gathering, the better. And staying within your household is the safest as opposed to combining other households. If you insist on having a Thanksgiving where other people are there, have it outside if possible. People still need to be wearing masks, social distancing, believe it or not, 6 feet away. Outside is best. If you have to be inside, open the windows. Single serve portions, washing hands, hand sanitizer, you're not spending the night in each other's home, things like that. But let me give you a caveat, though. With all of those things said, and by the way, the CDC has really, really great guidance on things you can do to make Thanksgiving safer. The safest way, honestly, is to do virtual holidays this season. With the case numbers rising as they are, I can't in good conscience say that being safer is going to be good enough. Being safer will help, but honestly, the safest is to do a virtual holiday because honestly, I think we've got more hard days to come. I'm not spending Thanksgiving with my family this year. We're doing a virtual holiday. I do encourage others to consider it because once again, it's the safest. But everyone has to make the right decision for them. So we just have to stay vigilant.
All right. Dr. Jen Caudle, family physician and associate professor at Rowan University. Great advice. Thank you so much.